Welcome to my trend. Today we should be looking at the 7 important tests that you need to do before marriage and pregnancy. Number 1 is an HIV test. Human immunodeficiency virus is primarily spread through sexual intercourse, and with marriage there is a potential for transmission of this HIV infection from one spouse to another. This act bears the risk when a spouse is a carrier of an sexually transmitted infection, specifically HIV. An HIV positive result does not really prevent couples from getting married, but helps them to make an important and informed decision to what to expect if they decide to get married and how to prevent it from spreading their babies when they give birth. This couple can live happily as a discordant couple where one couple is HIV positive and then the other one is HIV negative. The second test that is quite important is a blood grouping test, specifically rhesus blood grouping. A blood grouping is quite important when it comes to pregnancy, and the crucial element of this test is the rhesus factor. Women who are rhesus factor negative getting married to rhesus positive men have a greater chance of what's known as rhesus incompatibility. If they have this rhesus incompatibility known before pregnancy, it will help this couple plan on how to get what's known as an anti-D injection to prevent the mother's body from making antibodies against the baby's red blood cells, which may otherwise lead to intrauterine fetal death or miscarriages if not given during pregnancy. Normally, the first pregnancy goes quite well, but the subsequent pregnancies are at risk of miscarriages if the mother does not receive the anti-D injection. However, this test is not really that a standard of care for couples who want to marry, but it's quite important in terms of pregnancy for them to prepare and know what to anticipate for when it comes to delivery. The third pregnancy is genetic or genotypic screening. Normally, genes are the software which parents give their children. And some medical conditions, for example albinism, sickle cell disease, Marfan syndrome and others, are genetically inherited from the parents to the children. Genetic testing is very important when it comes to cases where there is prevalence of certain inherited diseases in a given area, or a family member for this couple has a history of a genetically inherited disease. Therefore, this genetic testing helps this couple to assess themselves if they are either carriers, and also assist them in making informed choices in conception, and understand that there is a possibility some of their children may have these inherited diseases. The test number 4 is a mental health assessment. Generally, a sound mental health is important for couples in marriage. Some mental health issues can be easily picked up, for example autism, cerebral palsy, schizophrenia and some of the neurodevelopmental disorders. These illnesses will need understanding on the part of the healthy spouse, and the knowledge for mental health status of the couples will help these partners to prepare in any case the couple needs either long-term care or any mental health care. And some of these conditions are basically hereditary in nature and may be passed down to their offspring. Then the test number 5 is a fertility test. Normally, the ability to have babies matters to many couples, and most marriages are either broken and are tested by fertility, and it's quite commendable if a couple does a fertility testing or screening if they suspect that they may not be able to sire or conceive. This test can be done by either male and female, and however some couples desire not to have children, and this won't really be a big deal for them. Test number 5 is a VDRL test, or a sexually transmitted infection test. Sexually transmitted infection number 1 that we talked about is HIV infection, and some of them, for example syphilis, gonorrhea, hepatitis B and other sexually transmitted infections, may need to be screened before this couple decides to get married. And with a VDRL, this term is a short term for a Venereal Disease Research Lab, which is a technique for screening sexually transmitted infections, and couples ought to know the state of their partners and help them make decisions either to seek treatment or not. And some of these diseases, if left untreated, may cause infertility, and some can be easily transmitted from one partner to the other. And lastly, we need to do a chronic medical condition screening. There are myriad of disease conditions such as asthma, hypertension, diabetes, mellitus, cancers, epilepsies and many others which are important for the couples to know. The importance of this test is not to teeth a pregnancy, but to help this couple make informed decisions in seeking treatment, and also even in staying happily. Some of these conditions can affect pregnancy, marriage. Couples need to understand the pre-existing medical conditions for their partners or which medical condition these couples are at risk for.